But anyway, what I said in 2007 in that report is many yoga poses are specifically designed as balance poses, utilizing arms, legs, and hips, the entire body, in fact. And there are many different ways you can balance. And for anyone who's done yoga, there are standing balance poses. There are poses balancing on your arms while resting on your elbows. There's on where your body is, resting in your arms, extending outside or straight out. There's all kinds of balance poses. It's one of the essential components of yoga. So it shouldn't be a surprise that it improves balance. An important note, all of the study participants, in fact, this is a crucial note, just an important note, all of the participants had their strokes more than 6 months prior to the start of the experiment. Why is this so key? Because it has long been held by the medical community. It's actually not just a belief, it's sort of an axiom of the medical community that any progress you make in a stroke has to take place within the first 3 to 6 months after the event. After that, you're stuck with what you've got. You can't improve. That's basically an axiom of the medical community. And yet all of the participants in this study who had quantifiable improvement had their strokes at least 6 months before, in some cases years before. The fact that you can make this improvement afterwards is pretty stunning. So it actually confirms other findings that have shown the same possibilities, that you can make improvement even more than a year after a stroke has occurred. And it also stands to reason that it keeps patients in better spirits, more positive towards treatment, if they feel there's a potential to continue getting better if they see results from their therapy. And as we said, balance is an important area to improve, not just for stroke victims, although falling is a serious problem among those with stroke-related disabilities. In fact, the numbers show that 75% of stroke survivors are prone to falling. As we know, if you're elderly, but even if you're middle-aged, falling can cause severe injuries or even death in some cases. Plus, fear of falling, if you're afraid of falling, can limit what a person will choose to do, the activities they choose to participate in, which in turn can lead to isolation and depression, all of which are already problems for many senior citizens, but as we see, they're easily and quickly compounded after a life-altering scare such as a stroke.